Hi everyone, welcome to Conversations with Sophia. I'm Sophia Ukor, the founder of Violet Simon, a media platform that uses authentic storytelling to amplify the voices and experiences of diverse women in order to push representation and equality, inspire others, entertain, and generate calls to action on key women's issues in all categories of life. Conversations with Sophia is a talk show where we bring in guests to explore these themes. And today we have Tinuke Aware and Clotilde Abbey, founders of Five Times More. Hi, Tinuke. Hi, Clo. Welcome to Conversation with Sophia,
Um,
and thanks for coming and joining us today.
Thanks
So,
for having us.
yeah, today we're going to be talking on about Black maternal health, which is what their platform organization Five Times More focuses on. And I think you guys recently did a research, right, on Five Times More. So let me, before we go into the research, I want to talk about your journey with, Black maternal health. What, like, starting with Tinuke, what was your experience, right? As a mother, with Black, being pregnant and postpartum and all that with, Black maternal health in the UK. And I'm sure that kind of spurred you into, um, you know, doing what you do with Five Times More. So what was your experience like?
Yeah, well, I had my son 5 years ago,
Mm-hmm.
um, and my first child,
Mm-hmm.
and it just wasn't a pleasant experience. Just to cut a long story short, it wasn't a pleasant experience. Obviously, childbirth is childbirth, but I had preeclampsia, which was diagnosed late. I had a range of things happen to me. I just didn't feel like I was listened to, and the whole experience left me, feeling like my voice wasn't important, and like, I just wasn't being listened to. And so, speaking to other mothers through another organization that I run, it's a social platform called Mums and Tea,
Mm-hmm.
speaking to a lot of other Black moms, new moms, hearing their experiences of giving birth, I honestly felt like something just needed to be done. It felt like um, there was a problem that really wasn't being addressed.
Mm-hmm.
So when the statistics came out about 5 times more, I approached Chloe because of all the work she does and said, should we do something? Like, should we have an event? Should we, what should we do? Let's do something. And yeah, that's how we kind of created 5 times more. But Chloe can obviously let you know a bit more about what she does as well and how we're the perfect match.
Mhm. Yeah, so yeah, tell me about that. Claire, what was your experience with Black maternal health as well?
So when Tinuke contacted me,
Mhm.
I was running an organization called Prosperities, where I
Mhm.
support Black and South Asian mum during a perinatal period and raising mental health awareness. And I also worked in fetal medicine and the assessment unit. So I used to work on the maternity ward. So
Mhm.
she thought it would be a perfect match to contact me and see what we can do to raise awareness, but just to reduce the disparities as well.
Hmm. And you working in the maternal ward, were there like things that you saw that made you think, you know what, this isn't right, especially with Black women, Black mothers?
At the time when I worked there was a lot of things that I saw, but I didn't really put it to because they were Black. Because
Mm,
the way my mind was thinking at the time, I was like, oh, this happened because it happened.
mm,
But like, I always talk about this one comment that was made to a young Black mother.
mm,
So she was in labor, and then the midwife came out and said, oh, why is she making so much noise? If she's making this much noise, how will she handle it later on? And she wasn't making this much noise when she was having a baby, etc. And then everyone laughed. And I
mm,
remember I was there as well. And I kind of laughed as well. There were senior midwives there, there were doctors there, and everyone laughed. And I think sometimes when you're in that space, you might not always realize what's happening. So when you come out of that space, that you're like, that wasn't the right thing to say. This is not the type of comment you should actually say. But
mhm,
at the time when I worked in maternity, there was little things like that that were being said or being done, and you don't really see it because everyone is doing nothing about it and laughing at it. You think, do you know what? Maybe I'm over the top. Maybe it is okay. But now I realize, no, it's not okay. It's never ever okay. And
mm,
it's comments like that that are very harmful as well to women. And then to know that a student midwife was there and stuff like that, they're learning the craft, and seeing midwives are saying comments like that. You know what I mean? It's just not the right way, and it's not the environment that you want to be in and kind of support.
And when you're talking about 5 times more, so what is 5 times more? Tinuke, like I mean, I know it's both of you that founded it. So yeah, I will start with you, Tinuke. What is 5 times more? And seeing that you said that it was based on your lived experience, right? And then you called up Clo to say, you know what, let's do something, right? And so what is 5 times more?
So 5 times more is an organization that is committed to highlighting and changing Black maternal health outcomes in the UK. We do this through three main ways. We take a three-pronged approach to the way that we try to do those things. Firstly, we lobby the government. So we had a petition that went viral in 2020 that led to Black maternal health being debated in Parliament for the first time ever. So we succeeded the amount needed. I think you need 100,000 signatures for it to go to Parliament. We got 187,000 signatures on that petition. And then the following year it was debated in Parliament. And we also have our MP letter writing campaign, where we encourage members of the public to write to their MPs to get them to sign the Black Maternal Health Pledge. We also have our Black Maternal Health all-party parliamentary group, the APPG, which was essentially set up by us, and we run the secretariat for. So it's a group of MPs from the House of Lords and House of Commons that come together to obviously discuss Black maternal health in Parliament. So that's one way that we believe you need to call on the change makers, the people that hold the powers to change things. Secondly, we train health professionals on the disparities, on the statistics. So quite often, obviously a lot of people know about 5 times more. Well, actually the real statistic is 4. It's got dropped ever so slightly since we launched. A lot of people think, oh, it's just something that's happening in America, or they don't quite know that it's happening here. So it's important to make sure that we're training health professionals all across the board, from doctors, midwives, sonographers, people that work in on the labour ward, to make sure they are aware of what the statistics are, what the background is, and just what they can do to help be a part of that change. And lastly, but most importantly for us, especially as 2 Black women with lived experience as well, is supporting women with our free resources and empowering them with education and resources, so they can feel like they have the agency to speak up. And we have so many different things that we have, and so many different partnerships that we've garnered over the years. So yeah, those are the 3 things that we do within 5 times more, and our recently launched report as well. So actually Clo, I think we should add a 4-pronged approach, because we do reports and research.
Yeah, so I really want to talk about that, because the first question is, you've talked about statistics. So can you, for the benefit of like maybe those who are not aware, what is the statistic? What is the statistic? What are the statistics for 5 times more? Maybe I'll take it with Clo, or do you know?
Of the disparities that Black women face, it's gone down to 4 times more now.
Yeah, so what is the statistics? Because Tinuke, you keep mentioning statistics. So what is the statistics?
So it's Black women in the UK are 4 times more.
Oh, sorry. Yeah, so I was looking at statistics. I'm having one of them days. Yeah, so Black women in the UK are 4 times more likely to die during childbirth, pregnancy, childbirth, and 6 weeks after. And it's very important that we count the 6 weeks after, because the deaths are happening 6 weeks after. So everyone thinks, oh my gosh, I'm pregnant, it's going to happen during childbirth. No, it's complications from childbirth that leads to the death after childbirth. So we tell women, once you have the baby, don't think everything's fine, I'm alive, I made it. No, this is a time where you have to really know your body, and if you feel like something's not right, say something to the doctor, your GP or midwife. And it's very hard, especially as a first-time mum. You might not know what is right, what is not, but you should be able to trust your gut. If you're bleeding heavily and it's too much, go and see somebody. If you know your feet are really swollen or you're still swollen, go and see something. If you're in pain, go and seek support, because the amount of times you hear that they will had retained placenta or they have hemorrhage, that's life-threatening. So we always tell women, yes, pregnancy, you made it, childbirth, you made it, they're dying at 6 weeks. It's 6 weeks. It is 6 weeks. That's where it's all happening. So that's a statistic. And then so mixed ethnic women are three times more, is it twice or 3 times more likely? I'm so Tinuke.
I believe it's 3.
3 times more likely to die during pregnancy, childbirth, and 6 weeks after. Asian women is also 3 times as well.
Wow, and that is so. It actually kind of is why I was kind of drawn to what you do. Remember that in my email, I'm like, this is so important because I'm a Black mother. I'm a mother, and I had similar experiences. Had my own lived experience where, my pregnancy was very traumatic, and because of severe hyperemesis. And then during the delivery, it was quite like, well, I didn't even have any energy. So I just managed to I had an epidural, so it was great. And just pushed this baby out. And it seemed like it was a huge success. And I think 20 minutes to 30 minutes after I had postpartum hemorrhage. And I didn't even realize I passed out. It was when I was talking about it, I'm like, oh, so I slept off. And because I was telling the nurses and the midwife, why is everything becoming white? Everywhere it looks white, like, and they were busy trying to look for a vein. And I think, I don't know, when I speak with a lot of moms, and I was fortunate to go private, but even in that sector, you still hear people who have like very, very horrible experiences. And then the question is it like, because it's not everyone that can afford to do private care. And even when you do, there is still there is still bias in that sector. I specifically went to look for an Asian woman and told her, I do not want to die. I was very specific about that. So I don't want to die. I need you to make sure I do not die through this pregnancy. And then the wonder is, do you think that when we're talking about like healthcare, and people talk about NHS, for example, in UK, and how if you're using NHS, a lot of people talk about the let's say they have a more traumatic experience. I don't know why that is. Do you have any ideas as to, is it more, because do you think it's more traumatic with NHS or private, or it's just the same everywhere? Because I know that, though I was doing private, there were times I had to go to the NHS as well. And every time I had to go to the NHS, I came back with, my BP was literally off the roof, and I was livid, crying because somebody's yelling at me about why am I not eating when I'm saying I cannot eat because I have severe hyperemesis, and telling me how, oh, the baby's gonna die, or I'm gonna die. And that's not something you tell somebody. So do you think that do you think that there's a lot to do? There's a lot more work to do, because with your work with 5 times more, you're training healthcare professionals. So do you think, I know it may be a bit controversial, but do you think, like with the NHS as well, as much as they're doing all the work that they can to do, that there is still a lot of, will I say, bias and cruelty, especially with respect to like women of color as well?
Do you want to take that, or do you want me to take it?
You can take it. I'm sure I'm going to add on.
Okay, one thing I was going to say is, what we need to understand is private or NHS, they get trained the same way. So that's number one. It's not no special one for this one. They're trained the same way. And I do think NHS is understaffed and stuff. But at the same time, I feel like we most likely always tell our traumatic stories as well. You don't really hear the good stories and the good treatment that some of us I've got given. We always hear, this happened to me, that happened to me. And that's why I've got 2 birth stories, but I always share one, which is the positive one. I know sometimes you want to hear the positive and negative to learn from it, but I want to give women encouragement to let them know, do you know what? You can have a positive birth. Even Tinuke herself, she had an amazing birth as well. And we both gave birth. I gave birth at the same hospital, both my children, so did Tinuke, and we both had 2 different experiences. I always say it's down to the midwife. It's all about the midwife that you get. It's always that way. And it's funny how you said when you went to NHS, it said, oh, if you don't do this, your baby's gonna die. I hear that a lot. And I think that's a way of them persuading you to go for an option that they feel like is best for you. So we always talk about informed consent, and that should be the way forward. You know, the woman needs to be informed before she decides what she wants to do. But as health professionals, sometimes they feel like we know what's best for you, so we're going to persuade you to go with that option. And instead of telling you what your options are, the pros and cons, it's if you don't do this, your baby will die. Now, if you don't do this, your baby's going to die. What are you going to do? You're actually going to do it. And I always say, sometimes, yes, it might work in a woman's favor. But I've heard it, we shouldn't put pressure. Because like you said, you go to NHS, your heart pressure goes up. That's not what you want. You don't want to go to NHS and your heart pressure goes up. And, you know, that could become a complicated situation for you and fatal situation for you as well. So I always say there's ways that we need to talk to women so they can make informed decisions that they want, not what we think is best or what we know is best. It has to be the woman's decision. I always say this, even if we know the woman's decision is wrong, it's the woman's decision.
Yeah, no, I agree. And just to touch on your point of people necessarily expecting better care because they go private, our research has found that regardless of your socioeconomic status, over 50% of women that filled out our survey were earned above the national average, and over 70% of them were degree level educated and higher, and they still ended up reporting very, very poor experiences. So you just have to ask that question. You know, if Serena Williams, you know, about I think over 5 years ago now, she, one of the richest, most wealthiest, most well-known Black woman in the whole world, can end up literally almost dying, not being listened to. She reported, you know, that she was in pain, and she was basically dismissed by health professionals. If not for the fact that she had had that same thing happen to her before and she had known the signs, she wouldn't have raised that alarm. We don't know where we would be today. So you have to ask that question as to what is the history there? Why aren't Black women listened to? And what else is going on there? It's a lot deeper than, well, if I have more money, I'm just gonna go private, I'm gonna have a good experience. I'm not saying that's necessarily not gonna happen, but you know, like Chloe said, it's the Eurocentric nature of what they are all being taught. We don't know what certain conditions look like on Black skin. It's not in medical textbooks. You know, and this is all across the board. It's not just in maternity. I remember I had a situation with my son a couple of months ago, hand, foot, and mouth. I tried to Google the nursery sent a link to the NHS about, oh, hand, foot, and mouth. Here are the signs. Here's what to look for. I saw no images of Black children on there. So how am I supposed to know what I look like? What it looks like? What am I looking for?
I was going to add on as well some of the stereotypes. The strong Black women, we can take more pain. And then that medical book that was taken out, was it 2012 or 2017?
It was, I think it was published in 2007, but it didn't get taken away until 2012.
Yeah, there was a medical book that showed how pain is on certain cultures, and on Black women, it says we don't feel pain.
Is outrageous, actually, because we do feel pain. I mean, it's just ridiculous how you just think that because of the color of our skin, we're not human, because a person who doesn't feel pain, I mean, yeah. So but yeah, and then when we're talking about like, I know we've touched on lived experiences. Are there experiences of women that you have had, or of other things in doing the work that you do, you know, with 5 times more, that have made you, you know, maybe how does that affect you, you know, as a person, as a human being, as a woman, as a mother, you know, when you hear experiences of women, when you see the way things are being done basically in the society, how does that affect you? What goes through your mind when you experience these things, or when you hear the experiences of other women who go through things like that?
Very hard. It's very hard. Because, you know, just advocacy in general, I think is very hard. But when you have such a sensitive topic like this, and when we both have our, you know, lived experience, one good, one bad experience, it can often, you know, make you revisit those experiences, those feelings. It can be just very heavy to hear some of the really awful negative experiences that Black women will often send to us, or copy us into emails and complaints, and just DM pictures of things. It's very heavy.
Yeah, to add to it, it's heavy, and sometimes you're like, this can't be real. And then you hear something else and you're like, how much worse could it be? Because some of the stuff you hear is like, how? Like, I'll talk about one woman, and this trigger warning. She had a C-section. C-section opened up, could happen, yes. And she said that, you know, it was smelly and things were coming out, and they'll tell her to get the bus to go to the hospital.
What?
Yeah, and then after that, you know, they checked her up. But then to her, it was like, you know, when you feel like you smell, so you think that the whole world knows that you smell. Yeah. So she had that pressure, and obviously she's a bit overweight as well. So she had how she felt about her body conscious, and she had 2 kids, so the new baby, then her 2-year-old daughter, and there was a lot. And then so she had to go there. They checked her out, sent her home, and every other day, every 4 days, she had to keep going to hospital to get changed while she still had a whole.
Oh my God.
It's a lot. And then when I saw, you know, when you hear someone speaking like, yeah. When I saw the picture, I said, oh. I don't know how it works, but I'm like, is this, are you, should you be moving like this? Is this okay? And then you hear stories of like how women, another trigger warning, are losing their baby over things that, when they say like it was that simple, that little thing got missed, and this is the outcome. And one of the young girls that we support, retained placenta, she kept going to the hospital, kept talking about it. She had a baby when she was young. I think she was about 17. She's chronically ill now. She's always in pain. Having a baby at 17 and always being in pain for the rest of her life. Can you imagine? It's very draining. So when we first started, Tinuke was heavily pregnant, and we thought this was okay. You hear here and there, you might hear some stories, but after a while, day after day, people messaging you stories, and they won't say trigger warning, by the way. You just get message. You're like, this is serious stuff. And obviously, we are mums ourselves. We go through personal issues ourselves. So on top of the personal issues, you get that is very, very draining. We don't get no aftercare. Only recently we started paying for aftercare for ourselves, because we advocate for women, we have resources for women, but women need an outlet, so they come to us and vent and share their stories. Even though that's not what we do, that's what they do to us, and we're happy to support. We can support, but then because we're not trained and we don't get support, it is a lot sometimes. But one good thing about working with Tinuke is I can go to her, she can come to me. If I'm by myself now, who do you go to? Yeah. So even though it's not right that we outlet on each other, we only have each other to talk to. Sometimes I'll be like, okay, this is too much for me, I can't take it. And she'll say the same thing. And we'll understand each other. We say, you know, let's take a little break. Let's take a 1 week break. Let's take a 2-day break. Let's not look at this today because it's too heavy. And then but when you're passionate and you want to help, you kind of, even though I'll tell somebody else, you know what, put yourself first, don't do this. You for yourself, you completely
don't do it, yeah.
And we be on it, but now we're getting better, we're putting boundaries. But then what makes it better is the good stories that you hear as well. Say, oh, I follow you on Instagram, and this happened to me, and I told the midwife, no, don't do this, and I got the birth I wanted, or I read your report. And so sometimes it's the positive stories that do help. So we ask women to send positive stories because we love sharing positive stories. We don't want to scare Black women. I have women that says, oh, I'm scared to go to hospital, so I don't want to close my eyes. Like what you did to the Asian midwife that you had. I don't want to die. You shouldn't have to go to hospital. I have some of my friends that's like, oh, I know Clo from 5 times more. You shouldn't have to go like that. Is that a threat? Saying that you know me. It's like, don't use my name like that. Do you know what I mean? But this is what Black women feel like they need to do to get the care that they need. Even it got to one point where I was like, if I ever get pregnant again, I'm going to make sure they know I'm 5 times more. No, why am I going there saying I'm 5 times? What? Who are, sit down? Do you know what I mean? Like, it shouldn't have to be that way. I should be able to walk in and feel like I am okay. I'm in the correct hands. I shouldn't have to feel like I need to threaten them for them to know that they need to treat me right.
Right, yeah.
Kind of waffled on, but you get the point.
Oh my God, that is so amazing, and it's, yeah, I love it. And you know, with the new research, because you did mention in the beginning that you're working on new research. So what's that about, and how soon are we going to see that?
Oh no, sorry, I was just referring to our report that we launched recently, but hopefully we'll be able to, you know, be commissioned to do a big piece again. The first report was fully self-funded. We relied on the free time of our volunteers, who were all Black, all female, all mothers. Pretty much all of them were mothers. So we had Black researchers, midwives, community groups. It was literally all Black led, and we're so grateful for that. But there are organizations that got money to do very similar work that couldn't even, you know, get even a third, not even a tenth of the amount of responses we did. So we just think, imagine if we got funding behind us. So yeah, we are hopefully going to work on towards that so we can get commissioned to do a massive piece of work.
I was going to say it's the largest study on Black women's experiences as well.
Yeah.
Today. Yeah.
It is. And you should be proud. Thank you for highlighting, you know, making Black women feel seen, and, you know, and feel seen and feel heard. You're doing a tremendous work with the work you're doing. And I do hope that, you know, even though you've said it before, Clo, that you say take care of yourself, but then when it actually comes to being practical about it, it's very, very hard. But please do take care of yourself so you don't burn out, because we need 5 times more. We need reports like this. We need the work that you're doing is so important. Not just for Black women, but even for other people, professionals. You know, people need to be aware, people need to know, because sometimes it's what you don't know that you don't, you know, when you don't know stuff, you just go blindly, and that's kind of what has been happening a lot of the time. But thank you for coming to Conversations with Sophia. Thank you for sharing a lot of your insights. Thank you for making me laugh as well. And though we had my network was a bit funny, but yeah, we've made it. And I hope you enjoyed this episode of Conversations with Sophia on Black maternal health. I hope you're able to take some things from that. And if you need to reach out and find out more about the work that they do on 5 times more, you can reach them on their website. I'm going to include their website in the description of this episode as well. So thank you, Clo, and thank you, Tinuke, for coming, and I hope you enjoyed being on the show. And once again, I'm Sophia Ukor. Until next time on Conversations with Sophia, take care and bye.